Okay. In men, we fix aneurysms when they get to be 5 to 5.5 centimeters
It's
of
at
diameter.
5 now.
So you're a little bit over 5. You're kind of in the area where we really need to consider fixing it. And the reason is this: if it ruptures, okay, you'll know it because most people, well, you may not, okay. Most people either have severe abdominal pain or severe back pain, like they think they're having a kidney stone or something like that. Okay, that's the most common. I feel like I have a kidney stone. Okay, and then you become very hypotensive or low blood pressure. Okay, of the people who rupture, 50% or half of them make it to a hospital alive. Okay, not dead. All right. Of that 50%, half of them leave the hospital alive. I'm not talking about healthy. I'm not talking about without a trach or on dialysis or any other number of things. I'm talking about you're just not dead when you leave the hospital. And that hasn't changed in 50 years. Okay, so the goal is to prevent you from progressing to a rupture. Okay? Now, how do we fix it? Well, there's basically 2 ways to fix them. Number 1 is the old-fashioned way, where we open your belly, we open the aneurysm, and we sew a new graft in, and then we close you back up. That's a very good operation in the right people, but it's a big operation, almost as big of a surgery as a person can have. Okay?
Very invasive.
That is the most invasive thing you could have, short of maybe opening your chest at the same time. Okay? It's as invasive as having open heart surgery. Okay, that's the level we're talking about. Open brain surgery, open heart surgery, open aorta surgery. They're all, okay. So, the other option, we put catheters in both groins. We run a catheter up and we reline the aorta from the inside, okay? And all goes well, you go home the next day. Okay, minimal disruption to your activities of daily living or life. Okay, of the 2, I would pick option 2. That's the more modern way to fix things. Okay, this is a model kind of describing what I'm talking about. Okay, so if this is right where your belly button is, this is your right leg, this is your left leg. Catheter goes up both sides. We deploy this graft, and now the blood flow goes in the graft, but not the aneurysm. And then out the legs of the graft to your legs. Okay. So the recovery time for this is a week maybe. The recovery time from the open surgery, where we split you open, couple of months. You'll be in the hospital for at least a week, but you won't be back to life as usual for probably a couple of months. So the better of the 2 options is this endograft. Okay. There's lots of different endografts out there. It does have, the technology does have some limitations, and that's based on the anatomy of your aorta and your blood vessels. So what we need to do is we need to get a different kind of CT scan than the one you had the other day, with contrast, okay? And what that'll do is it will give me a roadmap of not just the inside of the aorta, but the outside of the aorta as well, okay? In the meantime, what can you do? If you could stop smoking, it's going to go a long way to helping you.
Yeah, my brother is a doctor, and he, when I first talked to him about this, he's like, to my knowledge, there's no conclusive connection that can be proven, but he used the term ridiculously high number of aneurysms are smokers.
Yes. We do know that,
ridiculously high.
right, we do know that smoking contributes to aneurysmal growth. Do all smokers get aneurysms? No. Are all aneurysms smokers? No, but there are more aneurysms that are smokers than there are aneurysms that are not. And we do know that smokers' aneurysms grow faster. So that's the most important, not just from aneurysm, but from a whole body health standpoint.
Right.
Okay. So what I want to do is have you get this CT scan sometime in the next couple of weeks. We'll have you come back, and you and I are going to work out a game plan on how to fix this.
All right.
Okay. The risk of you rupturing is not so high that we have to go to the hospital and do this right away, but it's something that needs to be handled in the next 2 or 3 months. Yes. Okay, I'm not trying to scare you, but I'm trying to kind of lay things out for you. We need to consider having this done in the next 2 or 3 months. Okay.
Question. There was, I think, a generic Viagra that had Dr. Reardon. I have not taken it. is that a risk with this going on?
No, it shouldn't be. If anything, Viagra is going to drop your blood pressure. It's not going to increase it. Okay. It causes vasodilation. Vasodilation increases the caliber and the volume of being able to be held by your blood vessels and therefore can drop your blood pressure. So I don't think that that's going to affect your aneurysm. Physical activity. If you want to go run a marathon and you're healthy enough to do it, it's not going to hurt you. Running a jackhammer, jumping out of an airplane, that's not going to make your aneurysm grow. Okay.
Good.
So, as far as activity, you don't have to limit your activity worrying about this thing rupturing. But we do need to talk about getting it fixed. Okay. Other health problems: heart disease, heart attack, stroke, cancer, lung disease.
My father died of colon cancer, and I still say that was on the lower tabs. He ate from back surgeries and back pain like more than half his life, just like candy.
Okay.
And they took out 18 inches when they did find it.
Okay. But you don't have any?
No.
Okay. What about COPD, asthma?
COPD. I grew out of asthma years ago.
Okay.
When I was a lot younger, I guess kind of pre-puberty.
Sure. So let's get that CT scan, and then I'm going to have you come back and we're going to talk about the best option for you. I'm a firm believer in making the treatment fit the patient, not the patient fit the treatment.
Sounds good.
Okay. There is a very small subset of people who have aneurysms that are extremely complex. If you have one of those, then we'll talk about other options, either go into some place like UAB or the University of Mississippi or somewhere like that. It's not common, but I'll let you know if I think this is something that you need to go somewhere else to get fixed.
Okay.
And then I'll make some recommendations and some very good surgeons. Okay?
Sounds good.
Very nice to meet you.
You too.
Come on up.
We met once before. I go with one of your patients, Betsy West. You did the same
I got
with
you.
her about 13, 14 months ago.
Okay. She's doing okay?
Doing great.
Good. Come on out this way.